When Tony asked me to participate and to round this out, we spent about a half an hour, 45 minutes talking just about what her hopes were and her desires were. And rather than me prepare in advance, what I wanted to do is really come here, spend the day listening with you all and hearing what everybody was talking about so that I could really summarize what I heard and give you my perspective as a public health expert. And it was really incredibly valuable because, number one, I rarely get to spend a whole day in any one place at any one period of time. I'm usually in and I'm out, but I actually got to spend the entire day here, and it was incredibly illuminating. So thank you all for your great presentations, your discussions, and your insights. It was incredibly valuable. Just to give you a little background about myself and public health, my experience in public health, I am a native Chicagoan, born on the northeast side of Chicago. I am a pediatrician, and I'm also a mother of a 16 and a 21-year-old. And I've been in public health in the city of Chicago for about 20 years now. So I have that in my background that helps me approach this challenge that you're discussing today. As a mom of a 16 and 21-year-old, when I hear about the discussions here, it really hits home. Because, and also as a native of Chicago, growing up in the northeast side of Chicago, I never really appreciated what a wonderful community I live in and what benefits my children and I had growing up until I became an employee of the health department, where I went into Austin, I went into Roseland, I went into Englewood and West Englewood and many other communities in the city of Chicago, doing door-to-door campaigns to look at vaccine coverage levels, to do play street activities in communities that don't have enough green space or play activity space, that I really came to appreciate what my northeast side community has to offer. And for that, those are motivating factors for me and the reason that I accepted the position as commissioner of the health department. Because my background is really pediatrics and infectious disease type of work. And that's core public health. And so what I wanted to do is talk a little bit about what the public health approach is to addressing health issues and point out how that applies to this kind of work. So when I think about public health, traditional public health, what I think about is infectious diseases. Outbreaks of disease, whether it's foodborne outbreaks or infectious disease outbreaks like measles or mumps or chickenpox. And when we approach those kinds of problems, what we do is we have to do an assessment of the problem, understand who's getting sick, what's making them sick, understand who's at highest risk, who's really at highest risk for getting those infections, and then intervening, so stopping that problem acutely. And then looking at stopping that individual from spreading it to others. But then also, what is the systems that need to be in place to preventing ongoing disease like that? And so, for example, if you think about something like measles, we have an individual who has an infectious disease. When we identify those individuals, and we've had 3 in the past 2 months, which is very unusual because we've basically eliminated measles in the United States. We've had 3 cases imported into the United States. We find out who that individual was. We identify who that person was exposed to, who that person exposed. And then we go out there and we give them vaccine, or we give them immune globulin, or we track them and monitor them for 21 days to make sure that they don't get sick themselves and they don't spread that disease to others. And then we intervene and we stop the transmission. Now, that's traditional public health, but we've done a really good job with infectious diseases. Most of those infectious diseases are not that big of a deal. We have great systems in place for restaurant inspections so we don't have foodborne outbreaks all the time. So we have these systems in place to prevent the spread of those diseases. But because we're so good at that now, we can actually start thinking about the deeper, more root causes for poor health. And we're also looking at chronic diseases like diabetes, high blood pressure, heart disease, those kinds of things. And we look at those kinds of things. The only way we're going to really move the needle on improving health overall is by addressing the root causes of health. So it was great to hear Ben talk this morning and talk about housing and how important housing is to health. But it's also housing, it's transportation, it's education, it's community and economic development that really will make us healthier overall in the city of Chicago. And if we make some of the communities that I visit when I'm doing outbreak investigations, or when we're doing inspections for restaurants or inspections for underground storage tanks, I know what systems we need to have in place there to allow those communities to be as healthy as the community that I live in with my children. And so we started focusing on the determinants of health, and that's what Healthy Chicago 2.0, that's our plan, is really looking at those root causes: housing, transportation, education, community development. And what we recognize is that in order for us to do that kind of work, we have to use data, and we have to partner with others because we don't own those other things. Public health does deal with data for health, and we deal with outbreak investigations, and we have interventions in place, but we don't necessarily own transportation, housing, and education, so we really have to partner with other entities. And so that leads me into to this work that you all are talking about right now. And I think starting with housing was really a good idea because that's really the foundation. In order for us to prevent and to address violence, we really have to look at the root causes and the conditions in our communities. Unless we improve those conditions overall, we will not move the needle on the violence problem. But that's long-term solutions, and we recognize that for health as well. Those are long-term solutions that need to happen. But there's also this need to look at the acute problem that's happening right now. And that's what this approach is that Tony's talked about, that others have talked about as well, which is really looking at these acutely high-risk kids. This very small population of 2,600 kids who really need our help, and we need to intervene with them, and we need to do something really well and really coordinated. So what I was hearing in the discussions today really is that that's the pressing need. And we're in a crisis situation, and in crisis situations are often when we mobilize resources and we bring partners together. When Ebola occurred, when Zika has occurred, when we've had big meningitis outbreaks, what happens is resources come, people partner together, silos are broken down to address the problem. So we have a crisis in terms of violence right now, and we need to address the acute problem. While we're working on these long-term solutions down here at the root causes, we also have to look at that acute problem, which is these acute high-risk kids that really need our help. And focusing in on addressing their problems is really, really critical. So I think you made a strong case for the need. I heard there some discussions or allusions to the fact that Get In Chicago is winding down, and that concerns me because I think that the work that you all are doing and focusing on these high-risk kids, these acutely high-risk kids, is really critical. And the role that you play is essential because I was one of the 4% who hit the button that said a government does not have enough resources and they just need to be reallocated. Tony, because of your experience in government, you know. And me, for having been in city government for 20 years, I know we don't have enough resources to do all things. And we actually need public-private partnership and community engagement to actually move the needle and address this issue. And so Get In Chicago, please do not stop what you're doing. There's more work that needs to be done, and we want to work with you on this. And I think your approach, this right kids, finding the right kids, providing the right services, is essential. If we really want to address the acute problem, let's get those kids and take care of them. The city government and DFSS really focus in on that pyramid. We're looking more at the middle or the bottom part of that pyramid, providing One Summer Chicago, After School Matters, mentoring programs to these kids that are economically disadvantaged, those kids that are at increased risk, but not the acutely high-risk kids. So we will continue to do that kind of work, but we need help addressing that top of the pyramid. And so we want to work with you on it and want you to continue doing that. What I thought was really interesting is Rick Velasquez was talking about his use of the electronic health record and how that's really helped to coordinate their work internally. But I do believe, in addition to identifying who those right kids are, what the right services are, there has to be that kind of assessment of what those services are in the city of Chicago. But there also has to be some kind of infrastructure, electronic infrastructure, to ensure that we get those 2,600 kids and we're focusing on those individuals and then making sure that they have the services that they need, that we know where the services are, who's providing those services, and getting those kids plugged into those services so that they can actually get the comprehensive, holistic approach that they really need. It's what kids in my community get. We get that. They get that on a regular basis. But if we need in these communities that don't have those supports built in, we need some kind of electronic system in addition to the services being available to support those kids to make sure they're not getting, like someone said, Mikey's not getting 10 services and Joey's not getting 0. We can't allow that to happen. And so there has to be this kind of coordinated system that monitors and tracks where these kids are, what the services are, and really connecting them to services. So I mean, I don't have any answers because I don't know how we solve this problem with the siloing that we have. But I do think that this concept that you've described, Tony, which is this framework and understanding the landscape, focusing in on these kids that really need the most help and ensuring they get the right services in a coordinated way through public, private, and community partnership really is essential for us to being successful. And maybe Get In Chicago can play that overarching role in guiding us and bringing us all together to do this work in this point where we feel like there is a crisis. So I can't thank you enough for coordinating this meeting, bringing us all together, have this conversation. But I also hope that this is just the beginning, not the end. That this is the beginning for us to move forward together to really address this problem as we see that it's so important to address all needs within all communities so that the city as a whole is better overall. So I was peeking outside a minute ago, and I see there's great variety of food and wine available, and I don't want to be standing between you and that, so I will stop now. I'm glad to take questions if there are any.
Hi, I'm Deb Schleiss from Chicago Child Care Society, and all day I keep hearing about the need for bigger systems and data in particular, but I can't quite picture where that would reside and what entity would be responsible for those shared systems of tracking, coordinated care, tracking what organizations provide which services and where. Do you see a role for that in the Department of Public Health?
I think we could help. We have great data. We have data analysts. We have epidemiologists who manage and analyze data very well, so we could be a part of it. I don't think we're the whole thing. I mean, if you look at the risk factors for what's considered, or the definition of acutely high-risk children, you can see that we could probably identify data sources that could be pulled together to identify who those kids actually are, and then go and find those kids and engage them in the care that they need. But I would say Department of Public Health doesn't own those data, because if you looked at it, it was kids that are engaged in criminal justice system, kids that have had trauma in their lives in various kinds of ways, and we don't necessarily have individual level data in that way, but if people we were able to convene the folks who have the data, we bring the data together, we could probably identify who those young people are and then start engaging them and then getting them connected to the right services. So that is a place to begin, is to identify who those kids are and then getting them to the right services. And we're glad to play a part in that.
I hope Get In Chicago does this next year too. I think it should have been a little reframed. We talked a lot today about the problems and then solving the problems, but you started your speech with recognizing the opportunities you had for yourself and your children by where you grew up. And today's, maybe it's just my perspective, from today's conversation, it seemed a lot of discussion of we have trauma, we have problems, and here, how do we look at fixing those things rather than how do we stop those things from happening in the first place. So how do we institutionally affect the institutions that are creating the conditions rather than trying to fix the problems that are caused by the way the systems are set up?
I think that's a great question. So what I would say is that if you look at that pyramid, if you think about it more from a prevention and a control perspective, the prevention piece is this piece of improving community conditions, right? Because if we improve the community conditions, whether it's housing, transportation, or education, in those communities that are hardest and most affected right now, then ultimately we decrease the probability that children in those environments will suffer and then will end up in the criminal justice system needing to being considered acutely high risk. So we do have to address these community conditions, but that's not an immediate solution. That's a long-term plan, and there are systems that need to be addressed to do that. So I think what I'm really excited about when we were talking about housing is that there is this new Department of Housing that will be opened up, and there's a focus right now on the 5-year housing plan, which is being very engaged. There's a community engagement piece that I've not seen done before. They had millions of records of data they used, and they reviewed at the very first kickoff meeting to go over all the displacement that's occurring, gentrification that's occurring, looking at ways to improve affordable housing within communities, and then also just housing access throughout and improving the conditions within some of these harder hit communities. So there's a very deliberate effort at this point moving forward with housing. We're also working on a number of projects looking at transit-oriented development in some of our communities as well, which means looking at communities. We're looking at focusing on, there's a specific initiative that we're doing with MPC, Chicago Community Trust, Enterprise, Community Partners, in around 7 different train stations in 4 different communities in the city of Chicago, looking at developing the half-mile radius around those transit-oriented spots to develop the economic development, arts and housing, health, et cetera, all within those areas to develop those communities that need additional support. So looking at systems kind of change to improve the conditions within these communities that we're concerned about. So there's the Neighborhood Opportunity Fund that the city's running as well right now. This is just city examples that I'm talking about primarily, where we're funding when there's development within the central business district. If there's waivers that are granted for different waivers that are granted to the developers, they have to invest in a fund. And all those funds go back to these communities that need help to develop economically and from a housing perspective and business perspective. And so there's investment that's going on, but these are not immediate solutions. What we're talking about with Get In Chicago is this acute high risk group that we need to focus on right now. And addressing community conditions isn't going to address that for them. It's this next generation of people, these younger folks that are in those communities right now that will be helping. But we want to focus in on these interventions at the acutely high risks. So it's everything. There are things that are happening. What I'm focusing on right now is this acute need with the acute high risk. That's the problem. That's the outbreak that we're dealing with while we're looking at these longer term solutions. So I think both need to happen, and there are systems level changes that are occurring.
I'll make a comment and ask a question also. Just from my experience being a co-chair at Get In Chicago, and I do appreciate your comments and the value of what we're doing and the things we've done. But you know, at Get In Chicago, we kind of have an interesting seat that we sit on because we don't actually provide any services. We give away money, we do valuations, we identify organizations that are providing services, and we try to go in there and see if we can make them better. Initially, what we set out to do was find organizations that service these kids and see if we could scale them up. That was the thing, the suggestion from the mayor's office and others that thought that was the way to do it. When we thought that the problem that we were addressing were thousands and thousands and 10,000s of kids, all the kids in West Lawndale, all the kids in Inglewood and South Shore, until really with Tony's absolute total dogged manner, as she drilled down and researched and researched and researched and researched and finally told us, you know, all this stuff, it's a great feeling giving away all this money to these community groups, but by the way, you're not actually going to impact violence. You may do something that a young person that was likely to be a victim might be helped, and he might be in an after-school program, and he might be away from it. But the perpetrators aren't actually joining this stuff that's at the schools. So as we kind of sat and we evaluated, the thing that jumps out to me as a businessman, and I don't provide any services, so I'm not in the work that you guys are doing, are several-fold. One is the tens of millions of, probably hundreds of millions of dollars that are in and around this problem that don't really understand the nature of this problem. And the nature of the problem being, if you want to actually impact the violence, then you have to concentrate on those kids at the top of that pyramid. And many just don't even understand that. But the second thing that jumps out at me is the number of entities providing services that are absolutely not connected to each other, that are using data that's several years old, and I'll talk to organizations that are using data and making assumptions that at Get In Chicago, we already realized were not accurate 2 or 3 years ago, and that there's different sets of data, but they are going through the motions and administering the way they administer. As we now sit in the boardroom and wind down to the last year of Get In Chicago, and we've accumulated all this data and knowledge from all these organizations that we funded, the questions are, you know, what do we do with it? To the question that you asked. But there's several things that I certainly see, if it were to continue, that would address a need. The first thing I would do is, there needs to be an overarching organization that touches all these organizations that are so disparate and just not dealing with each other that touch the same problem. And maybe it's the organizations that get them for the kids between 10 and 13 and 13 to 16 and 16 to 20 and 24 that actually begin to talk to each other and have some consistency in the programming. There should also be some connectivity between many of the social services organizations that do the job training, the criminal justice, that deal with the advocacy around what happens in the prisons, and those sorts of things that aren't necessarily connected. And when I look out at the money that's now pouring into organizations and services around the organizations, like evaluation, which is amazingly expensive, you say, if there was a central repository that dealt with something else that was talked about ad nauseum today, which is the low level of compensation for people that are actually doing this, which is actually one of the most important aspects, but maybe that layer of organization could also advocate for a higher level of compensation, which I would be highly in favor of, for the folks that are doing this very, very difficult work. And so when you stop and think about what a next iteration of a Get In Chicago should look like, if it did exist, it should be something like that. Get In Chicago should not ever go into an organization by itself, in my view. So we would be, if we did continue to be, maybe we'd be 25% of that grant. And then we'd bring MacArthur, we'd bring University of Chicago, we'd bring Polk, we'd bring other folks that benefit from the data that we have and what we learned and the focus that we're doing. So all of a sudden, whatever we're doing is leveraged 4 or 5 or 6 times. You know, we'll sit down with the folks, the legislators and the folks in City Hall, and just say, what is it you're trying to address? Are you trying to keep kids in school? Well, this is where your money should be spent. Are you trying to focus on job training? Well, it should be in this direction. Are you focused on bringing down the crime rate of these young African-American male gang members shooting each other? Then it should be over here. So that's kind of the way that I would sort of see that next layer. I don't know what you have thoughts on that or not.
Yeah, I do. I think it's fantastic. I think Rick was mentioning this concept of braiding funding. Well, first of all, number one, I believe that there is a huge need for ongoing support and stable funding for organizations that are providing services, because I think that is part of the problem, is that either fits and spurts, whether it's government funding or whether it's private philanthropic funding, it comes in fits and spurts, and that's not sustainable. And so this concept of braiding and weaving together funding sources is really, really important to sustain work on a continuous basis, because all these kinds of activities, when we agree upon what is the approach that we want, having continuous and stable funding is essential. That's what's allowed us to be successful in public health. We have very few vaccine preventable diseases because we've had steady and ongoing support on an ongoing basis. So that's number one. I do agree that there is this need for coordination and integration of all these activities. Yeah, there's a good example of what we're trying to do actually with the outreach program, the CP4P, Communities Partnering for Peace. We've worked with Rick Estrada to talk about the work the Department of Public Health is doing. Government is funding some work in addition to the work that's being funded by the philanthropic organizations in the city of Chicago. These 9 agencies getting funding to support outreach work in 10 communities. They're standardizing their approach that they're using. We're also supporting some work in that area. And we're a step ahead of the game because we were already doing some evaluation. So building on our evaluation data, that's what they are using. So we're not starting from scratch all over again. So there's integration is beginning, but we're just scratching the surface. You're pointing out there's so many different levels that we could be engaged in. But if we that's not necessarily focusing in on this top of the pyramid. So we need to look at that top of the pyramid and figure out what it is we need, what sources of funding are out there, what activities are actually occurring there, how do we braid and integrate the work and collaborate so we're as efficient as possible. Nothing drives me crazy more than seeing duplication of effort in this area, because we have so much work to do that we can't be duplicating and stepping on each other's toes and having turf battles. What we need to do is make sure we're meeting the needs of as many people as possible with the existing resources that we have. And so this kind of concept of playing an overarching and bringing convener to do the landscape analysis and then to coordinate the care for the right kids, the right services for the right kids, that's the approach that needs to happen. And we'd be glad to sit at the table with you all. And we have the ability, whether it's Department of Family and Support Services that funds numerous agencies, or Department of Public Health, we fund numerous agencies as well. We come to the table with the agencies that we support as well.